G'day, I'm Ted Jednak, podiatrist and international educator of health practitioners in manual therapies, helping you get better results clinically and commercially. I've got this great email that's just arrived from Pete Shelton from Coastal Podiatry, east coast of Australia. And he's presented a very interesting case and more a reaction or response to his treatment. And so I've asked for Pete's permission to share what he's experienced with you all, because I know so many people will be able to benefit from Pete's experience. So Pete, thank you very much for giving me the opportunity to be able to share some lessons here with the wider FMT community. So Pete's explained a patient who has initially presented with hip pain, was going to be getting orthotics from her colleague, but once he did his evaluation, realised that FMT, she was a perfect candidate for FMT. She's an active lady, and it's one of his early patients. And what he has just done is he's given her the golf ball exercise, and now she's experiencing pain up the lateral leg in the perineals. She also has lesser toe deformities and describes the ball of the feet as having knots or a big ball there. Pete's also mentioned, thank you so much for your help. It's greatly appreciated. It's very reassuring knowing that you're willing to help us through this learning period. Thanks heaps. Pete, thanks. Thank you for the opportunity here. And for any of you, if you have a clinical presentation, you're not sure what's going on, just flick me an email and I'll be very happy to help you out wherever I can. Okay, so what's happened is with Pete's case here, a couple of things. In the early stages of rehabilitating soft tissues and muscle tissues, you've got to go through three specific phases. If you don't go through those three phases, what happens is you run the risk of either disrupting or actually creating more harm than good. Now, Pete's gotten off to a good start here when he's started his exercise routine with the stretching phase. So the three phases are stretch, then strengthen, then stabilise. Got to do them in that order. So the initial phase, stretching exercises. Now, the golf ball exercise is a specific exercise for releasing deep connective tissue restrictions and trigger points and tender points in some of the muscles that are overworking or overcompensating. In this case here, what Pete's patient has done is, I suspect, maybe gone a little bit too enthusiastically. In fact, he did say she's an active lady and tries to push through the discomfort to her credit. To her credit, her personality, great, she's willing to go for it, but she's probably done too much too soon. So with that type of irritation in the perineals, it is an important thing to give those muscles and those tissues a chance to recover. And you follow that rehab pathway. Go through some gentle stretching. First thing is, stop doing the exercise that's causing the irritation, stop doing the activity that's causing the problem. And then the second thing is gently rehabilitate by going through that stretching option. A variation on the golf ball, it's probably a whole new exercise, but using a golf ball, you can also utilise the golf ball and use it as a massaging tool on the perineal muscles to get some release there. What's important is that you've got to instruct your patients to go within tolerance, because sometimes with their enthusiasm they can do too much too soon and lead to these type of injuries. So go carefully and gently, and with any inflammatory reaction like that, often ice therapy can be a useful tool as well. So in summary, just remember the key phases that you need to go through whenever you're going through soft tissue rehabilitation. Stretch first, then strengthen, then stabilise. Now, in relation to the claw toe and hammer toe trouble that Pete's describing here as well, a very useful exercise that we've found in that stretching, releasing initial phase is one that we affectionately call saying your prayers. And what this is an exercise where literally the patient is in a kneeling position and the toes are fully extended, and they use their body weight to maximise and hold that digital extension. This in conjunction with whatever other therapy you're using. In our case, we'll use a lot of FMT, a lot of mobilisation, sometimes some soft tissue release techniques as well. but combine these exercises with your treatment modality so that you can get a longer term effect of releasing those connective tissue restrictions. Be warned though, you start doing that exercise, try it yourself, and what you'll find is that the initially patients will be able to hold it for 5, maybe 10 seconds, and that's all they can tolerate. So work within patients' tolerance level. It's not a matter of no pain, no gain. It's not. There's got to be some discomfort, but remember, it's work within your patient's tolerance. The other important thing that I've found over the years that if you want to get better compliance, cooperation, leading to better clinical results with your exercise prescriptions, do this. Give your patient one exercise to do at a time. I mean, sure, some of the exercise might be simple and you could teach them 2 or 3 exercises and pile it on. The fact is that your people will master a specific activity if they're just given one clear action. And in my experience, when you add too many, they come in the next visit and you say, well, show me your exercise and how they're doing. And they're doing a version or a variation of the exercise that nothing remotely close to what they should be doing. So if you're going to take one thing from this lesson, teach your patients one exercise, one activity, one specific action at a time. Then you'll get your chances, you get the probability stacked in your favour for getting better clinical results. So Pete, thanks again for providing the material and the fodder to be able to share your experiences and share lessons with others in the FMT community. Until next time, serve with spirit, consult with care, and help the health of humanity today.